The Minister of State for Health, Barrister Joseph Ekumaka, has stated that traditional medicine has been trusted, acceptable, affordable, and accessible source of health care for African populations for centuries, and that over 80% population relies on traditional medicine for their basic health needs. Barrister Joseph Ekumakama disclosed at the 2022 International African Traditional Medicine Day celebration on Wednesday in Abuja. Maliki Duro has more.
As Nigeria joins the rest of the world to mark 2022 International African Traditional Medicine Day, the Minister of State for Health, Barrister Joseph Ekumakama, said it's important to strategize on promoting and enhancing the role of traditional medicine in the health sector in Nigeria.
Services as their main source of health care. The availability, accessibility, affordability, and acceptability of TCAM makes it popular among communities. Achieving universal health coverage requires multiple approaches, which include the primary health care approach and the life course approach. It's pertinent to recognize and appreciate efforts made by our herbal practitioners and researchers in the development of local herbal remedies for the management of various ailments, particularly COVID-19 related symptoms, which forced several countries around the globe to look inwards for the search of new herbal remedies.
Speaking earlier, Professor Martin Zaneje and the Deputy High Commissioner to India explains the role of traditional medicine in the health and welfare of generations of people on the continent.
We believe that traditional medicine is not an alternative. It is conventional medicine that is alternative. We cannot be saying every time that 80% of our people are using traditional and complementary medicine, and then we are saying it is alternative. How can the majority be alternative to the minority?
And the opportunities are immense. We would encourage the Ministry of Health to have an MOU with the Ministry of Ayush, the counterpart agency for traditional medicine in India, and we could have an institutional framework for sharing of best practices, capacity building and training for Nigerian scientists in India, and even for joint research.
In his opening remark, Permanent Secretary Minister of Health, Mahmouda Maman, said Traditional Medicine Day gives opportunity to reflect on the progress towards African traditional medicine being afforded the prominence it deserves in national health systems.
It's important to note that 80% of Nigerian populace living in rural areas rely completely on traditional, complementary, and alternative medicine as their primary form of health care. The services provided by the practitioners have contributed positively toward achieving the universal health coverage in Nigeria. These services include traditional birth setting, traditional birth delivery, herbal medicine, etc. I wish to also add that the ministry has identified some eminent Nigerians for special recognitions for their invaluable contribution and leadership strides toward the development of TCAM in Nigeria.
It is hoped that African Traditional Medicine Day would help to strengthen collaboration between science, technology, and innovation institutions, traditional health practitioners, and the private sector to fast-track research, development, and local manufacturing of traditional medicine-based therapeutics for the health and well-being of Africa's people.